Hello folks, and welcome to Ability Maine. It's Mike Reynolds with Ability Maine. I'm a writer, and I've been doing this for over 5 years now. Storytime, storyteller, audio, video person. But I figured during COVID this would be really interesting to do, to document and have something for people to do besides read, because we were all trapped in our houses. And then I remembered that back in the AIDS crisis, there were grassroots television and grassroots and underground video producers doing documenting the AIDS crisis. And I figured, well, this is a pretty good documentation of the Maine disability experience, so I figured I will continue to do that. In late 2023, my hometown became the 10th workplace in America. I had a school shooting, it wasn't a school shooting, it was a mass shooting. There is a difference, and I do apologize. But yeah, Lewiston, Maine, this is actually coming from Lewiston, Maine. It has been since the beginning. And the mass shooting happened in 2 locations, both about a mile from my house. The shooter turned right by me and my roommate as we were trying to come home from buying laundry detergent, which is beyond surreal to live through. And it had really weird days, or weeks like this week, where there was a second, another mass shooting in New England, and we were stuck listening to that, and the manhunt that went on for hours and hours and hours, and it ended up the same way that almost the Lewiston shooting happened. So yeah, it's a little triggering, a little stressful, and this week already had been a very busy news week for a number of reasons, and we're going to kind of get to that. We're going to do this as soon as possible, as fast as possible, I should say, because we have here in Maine, it's extremely windy out, our weather's bad, and really I want to lose power. I want to be able to get this done, so hopefully we can continue to have power. And so we're going to be going through the fact that this governor of New York has in principle said she's going to sign an assisted suicide law, which means in 2 weeks, Illinois and New York join about now 12 other states, I think, to have assisted suicide. Biggest of that being California, Oregon, Maine, Montana, Delaware starts on the 1st of January. Vermont, I don't know them all. I should. I don't. But I'm also doing it off the top of my head, and I'm smart. I'm not that smart. And it's been a long week, and I've got a lot to cover. My God, I can't believe all the stuff that happened this week. So, with assisted suicide, we have, hold on, Governor Kathy Hochul has decided to sign the assisted suicide law, which was on her desk for almost a year. And it's a right to die bill for the terminally ill In the New York bill is a little bit different than majority of bills, in that you need 3 people, 3 doctors. You have to wait. It'll require a person having curable, irreversible illnesses and 6 months or less to live. To sign off on 3 doctors. In the New York Times is reporting that 12 states and District of Columbia and several countries in Europe have passed similar laws. Miss Hoto's Catholic, the Catholic Church is very much against this, wrote an essay saying that no one should listen to people suffering through the agony of a slow death and their painful experiences. Mirrored her own observation of a beloved family member, and her mother. She recalls her mom dying of ALS. And she doesn't believe that condemning someone to excruciating pain and suffering to preserve the dignity and sanctity of life. This is an essay she wrote in the Albany Union. And she also said that she was taught that God is merciful, compassionate, so we must be. I don't think making somebody overdose on a drug that is not meant to be used as a suicide drug, and that doesn't take. It can take up to 4 days to kill somebody. Is considered merciful, but that's just my position. I'm just a loudmouth disability rights advocate who has been working on this for about 30 years. It'll be 30 years in a few days. So, yeah. And this was done on Wednesday. She's going to sign it Wednesday. In January, formally Dr. Rockman changes she made to the bill that passed earlier this year, so it's been on her desk for, again, I want to say 9 months, but maybe maybe shorter, but it's been on her desk for several months. She added, there were amendments that are going to be added to the final bill before she signs it. They must provide written and oral requests to confirm that any decision was made of their own free will. The initial legislation required 2 physicians to testify to the seriousness of patient illness. Ms. Hochul this is a 3rd certification obtained by a psychiatrist and psychologist to ensure that the patient was not under duress, and the people who support this bill already called out a worrisome obstacle. It does require a 5-day period for patients to change their mind. It will take 6 months, take effect after 6 months after it's signed, so it won't be happening. And then there will be waivers for people who need to make use of the law sooner. Mental illnesses of any sort do not qualify. Any hospital set, I believe, means anorexia nervosa, which is a disease that causes a person to starve themselves, and can cause some grave issues. And it's no longer was considered terminal for a while, but in the U.S. it is not considered terminal. I'm not sure if it's considered terminal in Europe or not. There's a little bit of a hesitancy in terms of how, I know that there was a U.S. change in definition since the Maine law went into effect. I'm not sure what year that was. And I'm not sure if that anorexia being terminal was also applies to Europe or not. I've read conflicting issues. I know it's some really small details, but I'm pretty, I try and be really accurate on this as much as possible. A hospital that doesn't want to can opt out. That's the same thing in Maine. This alone would apply to New York residents. You can't go there. You can't come from another state. Although I don't know how. I know there are states like Oregon and that do allow that to happen. So that's one of the major issues. And the scariest part of that is that this is a disturbing trend. We've had it happen in it passed in Illinois last week. It's passed now in a dozen states. So this will be state 13. I'm sure Massachusetts will probably be one of the next ones to debate and pass the law. The only reason why it hadn't passed before is because they had some really incredible advocates against it, like John B. Kelly, who no longer is alive because he died in November. So, without anyone able to replicate his actions, I don't think it's going to have much of a chance to, much of an issue to pass. And I believe Maura Healey's already said she would sign the law. I believe that was something she said during when she ran for governor. So, I mean, we know the writings on the wall. And my fear is that it's going to really start to change the way people are cared for. And maybe not in small states like Maine, maybe not now, but, we've seen people being denied chemotherapy that costs hundreds of thousands of dollars, which is very effective for certain type of cancer, and being asked to go into, consider, assisted suicide. And that's, difficult. And I don't know if that's going to happen in the next year or two, but certainly I never would have thought 30 years ago we would have, or we didn't have any states 30 years ago, so we never would have thought 20 years ago we would be up to 13 states in D.C. and European countries. But that's where we are, and I know there is a lawsuit in Delaware to prevent the Delaware law going into effect. I know that's being brought by the Institute on Patient Rights, ADAPT, and another group as well. To try and challenge in federal court the Delaware law that goes into effect on January 1st. So, in other news, this this is huge news. Marijuana rules. Yesterday, President Trump signed an executive order to downgrade cannabis from from reclassification from Schedule 1 to Schedule 3. It does not decriminalize or do anything with marijuana laws other than make it a Schedule 3 drug, which would be the same schedule as ketamine, according to everything I've read. And he's also going to authorize a Medicare program for products made with CBD, a particular compound of cannabis that is not psychoactive. That's kind of interesting because CBD pretty much has been used in recent history to be converted into Delta 8 and Delta 10 because of the 2018 hemp bill, the loophole in the 2018 hemp bill, which allowed for that to happen and made it reasonably economical to do so, financially viable to do so. The chemistry involved is not that hard. It's been around since 2006. There was some earlier stuff around that in the 60s, but it ended up being poisonous. But in 2006, it was how Delta 8 became a thing. So it was about 20 years ago. So with CBD, that should help a lot of people. It's used in one pharmaceutical drug that's extremely expensive. It's like $35,000 for epilepsy. And I'm not sure about the effectiveness of it. I don't use it myself. I use what my doctor told me to use. I've been seizure free for almost 10 years, so that's really good for me. But it is going to be awesome if Medicare will be able to pay for CBD. My fear is I think a lot of people would have are worried about how it's going to affect small caregivers and small growers of marijuana and cannabis in states where it is legal for medical and or recreational use. In Maine, there is a recreational ballot initiative to try and get recreational cannabis taken out of the recriminalized. They have until February 2nd. I don't know what that will do in terms of this. Also, the Catholic Votes, which was a nonprofit or a PAC run by the Catholic Church, was actually against this. Again, I don't understand why, because cannabis is a drug that was made by God. But anyway, and I grew up in a very Catholic family. I don't understand it. But this classification does help a lot because it will give an acknowledgement that from the federal government that cannabis has some medicinal value and low potential for abuse. And they're saying that this may actually be able to help with taxes and federal taxes, because now that it has some medical uses. Some of the issues that with banking and other information, banking and tax forms might actually help the cannabis industry, but then again, does that mean that it's only going to help the big players and multi-state operators that are screwing rules and not, transporting, or supposedly not transporting? But, you see, especially in Maine, multi-state operators coming in, the cannabis havens, the cannabis, and Curaleaf is another one. And the weed is apart. Hopefully, this doesn't kill small growers who are making great products for people. I know that that's the biggest fear, especially amongst, parents and children who use it for a variety of epilepsy disorders and other major disorders in Maine. I know Maine, Maine is one of the very few states that does allow for very easy access for, or much easier access for juveniles to use cannabis therapies compared to like California, where it's basically unheard of. So, I never used it as a underage youth. Just back then, the strains didn't exist, and the infrastructure wasn't there back in the late 80s, early 90s. But the infrastructure being there and the testing and the everything, it's kind of scary to see what could happen if this continues, or if smaller caregivers are pushed out. Again, this will take a few months for it to see what the actual effects of it are. In additional news, President Trump has banned all forms of gender therapy for transgender youth in America. I'm not sure if I don't think that's effective immediately. I think that there's got to be, it has to have some sort of policy written and laws written and passed, which may be an issue, and I know that there's going to be court cases around that. It's really telling that Judith Butler, who uses pronouns they, them, and is a feminist scholar, has said that you can tell fascism is starting when people are willing to get rid of sacrifice trans youth. And she said this they said this long before it was an issue, and before this came out. And Trump has said that he's going to target federal monies if a hospital does continue with care. So that's pretty much a death knell because most households rely on some form of either federal funding, federal research funding, or Medicare or Medicaid to sustain their bottom lines. So again, that's going to the ACLU is obviously going to challenge it in court. I know that there could be hearings and rulings and testifies and public comment periods, so there's never a chance to lose hope, although it's only, I'm not sure if it's an executive order, but it's sad, and it's very backwards, and it's not right for anyone. Additionally, I do want to talk about a couple things before I go. ABLE accounts are accounts that people with disabilities who receive okay, so ABLE accounts were started by the ABLE Act, the Achieving a Better Life Experience ABLE Act, passed in 2014 to create a way for people with disabilities and their families to save and invest money without jeopardizing eligibility for critical public benefits such as SSI and Medicaid. ABLE account functions similar to a 5% savings plan that allows individuals to deposit every tax fund to a special savings account that can grow tax-free. The money is used for qualified disability expenses, and they're broadly defined. It may include things like housing costs of food, transportation, technology, healthcare, wellness, prevention, basic living expenses, education, training, and related support, and personal support services. You have to have up to $100,000 does not come towards SSI or SSDI's 2,000 asset limit. That makes the program a useful tool for helping individuals save for their future needs by maintaining essential benefits. Since what goes into effect the first year will be under the current law, only an individual who developed a disability before age 26 were eligible to open an ABLE account. This restriction excludes many people with disabilities or disabilities later in their lives, such as through accidents, chronic illnesses, or military services. Now that age limit has been up to 46. So, beginning January 1st, 2026, it's supposed to make about 6 million more people eligible. Again, it matters because it allows people like a military person who was hurt in, before before they were 46 will now be able to open an ABLE account. Somebody who was diagnosed after age 26 with a chronic illness like MS or something like that will be able to get it if they're under 46. And a lot of people with MS don't get their diagnosis until the late 20s or early 20s to late 20s and not even early 30s. So hopefully this will help. And it will help basically people who become disabled later in life be able to save, like, regular people who were born with it were. Again, that's up to $100,000 a year in their account. I'm not sure what the yearly amounts are. It does, the accounts do provide a lot of flexibility in terms of what you can use them for and how often. And that's that type of thing. So again, if you do a Google search, you can find a lot more information than I can talk about right now, but it's really important for people to know about because it comes into effect. These changes are, again, going to start on January 1st. And I know that there's locally Bangalore Savings Bank does offer able accounts. I'm not sure if they're related to banks and credit unions. Again, I don't know. I know that they have to be a very specific account to get them. So again, that's kind of like an issue as well because I use credit unions for me personally. But again, just doing research, there's been some major changes to it, and you should, if you're interested in them, definitely take a look. And Google is your friend. I found a lot more information just doing a quick search and reading up on a couple of different articles. And it looks like there's going to be more and more Republicans have transferred to the Democrats in the Accessible Care Act, a vote to try and keep the subsidies alive is going to be happening. If you want to get more information on that, you may want to call in Maine. You can call Consumers for Affordable Health Care. They're saying excuse me, my mouth is really dry. I need to take a sip before I finish. So that will may change, but the problem with that is that there is, in order to receive services by February 1st, you need to sign up by January 15th. We don't know when that vote's going to be. We don't know if the subsidies are going to be there or not. What I would do if you're in Maine and you have questions, call Consumers for Affordable Health Care. Their number is at, of course I get one that doesn't have their number. 1-800-965-7476. That's 1-800-965-7476. They should have some help if you're still trying to figure out what ACA healthcare option you want. You can go to covermaine.gov for that, or give them a call. I'm going to add that 800 number. It's the holiday time of year, and it's very in Maine it's very windy and stormy out, so it's a nice well, it's not so cold, but it's extremely windy. So we will be back next year with more story times, and hope you have a great Christmas and Hanukkah and Kwanzaa and New Year, and we'll see you next year. Peace. That's Mike Reynolds and the Ability Maine Storytime for December 19th, 2025. Have a good one.